Good morning, everybody. I'm Dr. Padma, and I'm going to talk on understanding hypertension. So, what is blood pressure? How it happens? What could be the risk factors, and how to control it? So, generally, you all know one of the major complication-inducing condition could be hypertension, which can cause heart failure. It can cause a stroke. It can cause renal failure if not under control. So, what is it? Hypertension is when the heart beats, the heart pumps, and the blood enters into the blood vessels. The pressure changes which happen against the blood vessel is called as a blood pressure. You measure with the sphygmomanometer, and if there are two readings, one is a systolic reading and another thing is a diastolic reading. A systolic reading is once when you keep the stethoscope on the brachial artery, and then when you hear the first beating after you compress with a BP cuff. So that is the systolic blood pressure. It is due to pumping of the blood from the heart, and then the diastolic blood pressure is due to the peripheral resistance in the vessels. And that is when you don't hear the sound. So that is your diastolic blood pressure. So normal blood pressure is 120/80. So 120 is the systolic, 80 is the diastolic. So if a BP is high, it means that the blood pressure is more than 140/90. That is 140 of systolic and 90 of diastolic. Anything above that means that the patient has got hypertension. Once a patient has hypertension, you should not just immediately declare that the patient has hypertension. Be it the doctor has to do at least 2 or 3 readings. If all of them are consistently above 140/90, then it is meant by hypertension, and the doctor has to start the patient on low salt diet, lifestyle modification, and then medications. So, high blood pressure, it is not that it happens within a day, it happens over time with a lot of changes and risk factors which can precipitate hypertension. So, what are the risk factors? As the patient becomes older, the patient's blood vessels become thick, and thereby the blood pressure increases. There can be a family history of hypertension. The father or mother might be having hypertension, so the child will have hypertension earlier. Not eating enough food with potassium, high potassium, can also cause hypertension, and taking high salt diet can also cause hypertension. Eating processed foods, fatty foods, and all junk foods, taking an inappropriate time, taking food very late, all of them can cause hypertension. Very, very important is stress. Nowadays, we have the children, from the children to elderly, everyone has stress, and stress can definitely increase the incidence of hypertension. So, what is it? Hypertension is a silent killer. If not treated in proper time, it can lead you on to complications like heart failure, stroke, eye damage, eye retinopathy, which can cause blindness, a renal failure, which would warrant the patient again to go and develop take dialysis if it is not under control. So, very accurate diagnosis is something very, very important. High BP is very easy to diagnose. Go to the clinic. The doctor will check your blood pressure with the sphygmomanometer, systolic and diastolic. If it is above 140/90, it means that the patient has got hypertension. Once the patient is on hypertension, what is very important to take a low salt diet, because salt will cause fluid retention, which will again increase the weight. It will also increase the blood pressure. So a low salt diet, taking around 1,500 milligrams of salt or sodium is something very essential. Below that, anything more than that is going to add on to hypertension. Taking high potassium diet will also reduce hypertension, like green leafy vegetables, fruits which have high potassium are very good. And again, if a person has habits of alcohol intake or smoking, you need to quit it as soon as possible. Regular blood pressure monitoring is important. The patient can itself get an electronic BP machine at home, and then they can monitor, because there are two entities. One is called white coat hypertension, one is called masked hypertension. What is white coat hypertension? The moment the patient comes to the doctor's clinic, the BP will increase, and that is called as a white coat hypertension. For that, the patient should have a BP measurement at home, where in a calm surroundings, if the patient takes BP, it might be normal. Another thing is, in the doctor's place, the BP will be normal, but in the office settings, the BP will become very high due to stress. So that is called masked hypertension. So both of these entities, if they have to be ruled out, we need to ask the patient to take blood pressure monitoring even at home. So ambulatory blood pressure is something very, very important. Regular BP monitoring is very important to prevent any of the complications due to hypertension. Reduction of stress by doing yoga, meditation, doing some aerobic exercises, or sleeping properly. At least 6 to 8 hours of sleep is important. Adherence to medicines are also very, very important, along with a lifestyle modification. So at least 40 to 45 minutes of any aerobic workout would be very helpful, not only to reduce weight, but also to reduce the blood pressure. At least 5 days a week, they should definitely take. A healthy diet. A healthy diet is a DASH diet. DASH diet is a dietary approach to stop hypertension, which contains a lot of legumes, it's virtually like a Mediterranean diet. You give a lot of legumes, fruits, vegetables, and avoid unsaturated fats, cholesterol items. This change in diet itself will reduce your blood pressure systolic by 11 millimeters. Then sodium restriction is something very important, and taking food rich in potassium is also very important. Quitting smoking is important, and regular BP monitoring is important. Always keep your blood pressure below 140 by 90. Anything below 110 by 70 is a low blood pressure where your dosage can be reduced, but keeping it within the range, that is from 120 to 140 and 80 to 90, is definitely essential to prevent complications. Stress management, a person can go for a yoga class, do some meditation, and then they can do some relaxation. There are a lot of therapies available for meditation and stress management. If they are too much stressed or anxious, they can see the psychiatrist for counseling. So adherence to medicine is something very, very important. Keeping BP under control is important, because blood pressure, if it's going to increase, it is going to cause heart failure, it is going to cause stroke, and the patient's lifestyle and the quality of life will definitely get affected. The eye changes, the retinopathy can happen, the retinal bleeding can happen, which would warrant a laser therapy. And the renal changes, the changes in the renal pressures and the changes in causing proteinuria, all of them can cause a chronic kidney disease. If still not under treatment, then the patient can land up in dialysis soon. So very, very important for you people is to understand what is hypertension, what are the risk factors which can precipitate hypertension, and what all are the measures which as a patient you can take. So basically, a healthy diet, a healthy lifestyle is something very, very important. Taking a low salt diet, less than 1500 milligrams of salt daily, and taking a very high potassium diet, like taking a lot of vegetables, fruits, legumes. This is also very, very important. And along with that, exercise. So diet and lifestyle for a major stage. So DASH diet, a diet to stop hypertension. This is something which you have to follow. Avoid all the processed foods and take a healthy food, freshly cooked food, and take everything less. Don't take a full stomach and go to sleep. So take around 50 to 75% full of your meal, whatever you take, and let the plate have less of unhealthy food and more of healthy food. So fried foods and junk food stuffs, high salt diet, like pickles and aplams and all those things have to be definitely avoided. So take care of your diet, take care of your exercises. And again, if your blood pressure is above 140 by 90, 2 or 3 readings, then definitely when the doctor prescribes you on medication, don't stop medications. See to it that you're taking your medications in proper time, and you see to it that your blood pressure is controlled all the time, so that you don't have any complications. Thank you so much for the patient listening. I hope you would have had a good understanding about hypertension, and try to follow whatever I have told to you, so that you have a healthy diet, healthy lifestyle, and then you have a peaceful and a happy life. Thank you so much.